Tanveer Ahmed is a psychologist. Dr Tanveer Ahmed joins us now. And, well, Tanveer, you just heard some of those comments from real live Australians who are upset, who are anxious, who are feeling the hurt, the pain from what we've been going through. We're all kind of in it together, but really there's a smell about it. It's the depth of it is really quite bad, and people are hurting. They're taking it personally, Tanveer.
Look, it was heartbreaking hearing some of that, Gary, and you're right, people are struggling. On one level, we're all in it together, but on another level, specific groups are hurting a lot more than others, aren't they? And you alluded to some, you know, be it FIFO workers in WA, and in my practice, a lot of young people who used to have the structure of work in, say, hospitality, arts, tourism, where the industry is most affected. Many of them have now lost that structure and they're resorting to substance abuse. You've alluded to state leaders who, traditionally they would have a provincial air, but you can see them really embracing a kind of authoritarianism. You know, they're loving it and, really applying it very strictly. And we've seen it in some of the decisions, isn't it? We've only this week, we've seen Queensland overturn the decision around the ACT, and that's not based on any new public health data. It's entirely because the optics look much worse. So, I mean, it's another example. On one level, we keep getting told, oh, the science, but it's often not the science. It's often on a whim, and it's often based on a very poor trade-off of risks. It's often public health officials taking a very narrow view of risk in arenas they're narrowly trained in and just unable to see the various trade-offs. So, I mean, other groups, I'll tell you some other groups I'm seeing in my work, Gary. So, for example, in Victoria, you've got a lot of the kids who just can't do remote learning for extended periods. I mean, they're going to really struggle. They're going to fall behind, and that's going to have very long-term, that's going to have long-term impacts. Now, I've alluded to a lot of the young people in work. The elderly now in a lot of the homes, some of them, some of them are going to border on dying of loneliness. They're getting so little input, so little affection. And there's all these other human necessities that are just getting, put on the sidelines, for narrow gain. Now, we all know the aims, but they're just being seen too narrowly without any of the kind of sensible trade-offs at the moment. I mean, you alluded to some of the people coming out. It was interesting this week, Gary, where a Victoria former Treasury official came out. He was essentially a whistleblower. And he came out and he, both on Twitter and in the Australian Financial Review, basically saying, well, I was in there making the decisions and helping advise the government, and I saw for myself that the government just were not listening to the broader data. They weren't even making attempts to kind of see the trade-offs and spread risk.
Well, I think, Tanveer, a lot of people now are seeing that governments are into ruining people's lives who, once they dig themselves down a particular pathway, they won't change. There is none of that flexibility, although maybe the decisions in Queensland announced today are more about the science of psephology. In other words, the election polling that's going on, with an election 6 weeks tomorrow, more than anything else. People aren't necessarily trusting governments at the best of times, but right now, I reckon they're not trusting them at all.
Well, I think the tensions are starting to fray a little now, Gary. That's my assessment. Now, you look at some of the polling, the reality is in parts of Victoria and even in Queensland, there is a parochialism, and there are significant portions of the population that do have, what might be called a safetyism psychology, and they want the risk to be near zero. And, often those groups are perhaps ones that are less affected by the lockdown. And what ends up happening is other groups who are severely affected are being penalised, often for an unhealthy inability to kind of bear any type of risk. That's really what's going on for large sections of the population. So look, I think we're, if not at a breaking point, we're not far from it. But maybe governments are starting to get that.
We're not far.
But governments possibly
maybe they are.
Sorry, Gary, go on.
Well, maybe they are. I mean, today in the hotel quarantine inquiry, there was talk about PTSD being a reality for some of those who were forced into the 2 weeks mandated quarantine. I guess people are lining themselves up for lawsuits potentially down the track. But what about people who've been in essentially a 6-month lockdown? I mean, there's a traumatic stress associated with this. It is not unreasonable that people need toolkits to survive what they're currently going through.
Well, we've we've heard those right throughout the pandemic, Gary, where, you know, trying to get sort of routines, obviously connect as much as possible on social media, get exercise where you can. You know, Victoria, they get their 1 or 2 hours where they're allowed outside of the house. I think people are thoroughly aware of that now, and they've heard the messages, but I think they're just getting sick of it. You know, it's just getting tedious. There's only so long you can keep up those sort of fairly, you know, limited routines, especially when you don't necessarily entirely see an end in sight, or you don't see clear reasoning behind the decision-making. But, look, on balance, people are doing that, but at the same time, I think they're starting to hit a kind of, you know, real sense of, you know, there's a bit of a burnout happening. There's a burnout happening, I think, amongst large parts of the population.
Yeah, I think that's right. Thanks for your time, Tanveer. Good to see you always, and appreciate that. Now, you've got a new book out as well. You want to give us a quick, gratuitous, free plug on national television for it?
Yeah, absolutely, Gary. Thank you. So I've got a new book out called In Defence of Shame, and it's a really look at the return of shame in Western societies. But I'm arguing that it can be useful in a range of areas. We just need to harness it usefully. That's a quick précis of the book, Gary.
All right, sounds good. Look forward to seeing more of that. Tanveer Ahmed, thank you so much for your time tonight.